Hi folks, welcome back. It's Kara. We're going to talk about postpartum mood and anxiety disorders. So this topic is super important because the most recent data in the last 2 years of the perinatal mortality review have shown that postpartum depression, mood and anxiety disorders, and overdose are the leading cause of death amongst people who have recently given birth. So I say this not to scare you, but because it just makes it even more critically important for you to know that we are here to support you. There are people that are here to support you. These kinds of conditions are not meant to be weathered alone. And it's completely understandable that given the stigma around drug use, given the stigma around mental health, that people are really suffering in silence, and it doesn't have to be that way. So let's talk about some of the common postpartum mood and anxiety disorders that may come up and how you can seek support around that. So the acronym that you may hear is PMAD. Again, that stands for postpartum mood and anxiety disorder. It's what I've been talking about so far. Postpartum anxiety can come up as just like this unshakable feeling that something is wrong, that what you're doing is wrong, that something bad is going to happen to either you, your baby. It can feel like hypervigilance. It can feel like a racing heart, sweats, inability to sleep, irritability. It can feel like upset stomach or chest pains, because our gut is linked to our brain. Like when we are unsettled, our body feels that. It's sending signals to the rest of our body to be on red alert, to slow down digestion, to be hyper aware of our surroundings. And if you're feeling these feelings, please reach out to people you feel safe with. It's already a stressful time to be a parent. It's a stressful time to be going through any of our normal postpartum experiences, but especially as a person who uses drugs or is reliant on the sex trade or choosing to be in the sex trade to support our income. Sometimes we're just anxious about lost income. Sometimes we're anxious about the intervention of the family surveillance state. Sometimes we are experiencing trauma from our births or a wide variety of experiences. And so anxiety can come up, but that doesn't mean that you need to try to white knuckle it. There's a lot of ways that we can access support, and it's really important if you are experiencing these feelings to think about what makes you feel the most safe and expressing those to other people. Postpartum depression is generally characterized by like feelings of hopelessness, like my baby would be better without me. I'm never gonna get through this. I don't know what I'm doing. I have a hard time getting out of bed. It doesn't feel worth it anymore. These feelings can manifest in just feeling like extremely tired, extremely lethargic, extremely achy. It can affect your appetite. It can affect your motivation to take care of yourself through showering. I already mentioned eating, leaving the house. And again, like as a person who has already weathered so much, given the way that substance use and pregnancy is already stigmatized, or being in recovery and being pregnant and parenting is stigmatized, we want you to be able to access support so it isn't harder than it has to be. Depression is a real thing, and we want to be able to help you access the support that you need. Postpartum OCD, which stands for postpartum obsessive compulsive disorder. This looks like intrusive thoughts, like the constant thought that you're going to drop your baby, that something's wrong with your baby, that something's going to happen to your baby. Sometimes these intrusive thoughts can be things that are even scarier. Like, thoughts that you might want to harm your baby or harm yourself, or that your baby is sick, or that somebody is trying to take your baby, or God wants you to not be a parent anymore. There's so many different ways that this can manifest. It can manifest in feeling like you need to compulsively move through rituals like washing baby bottles or changing baby's diaper over and over and over again to make sure that it's not used and dirty and causing them any harm. These are feelings that oftentimes get like suppressed and buried because people feel really ashamed or think that somebody's going to think that they're crazy or not believe them, or worse, believe them and try to take their child away. And this can be a really challenging thing to experience, let alone experience by yourself. And it is treatable. There is support for it. You don't have to go through it alone. It is common, and often more common than we think because it goes underreported. So we want to be cognizant of, like, these feelings are coming up and you're hearing this voice in your head that's telling you things that are making you feel scared, or are making you question yourself. Please reach out and talk to somebody that you trust about that. Postpartum PTSD. So labor and delivery, or child separation, abortion, adoption, the family surveillance state, hospitals can cause a lot of trauma. And trauma is when an event is experienced in our body that feels abnormal and triggers our nervous system. So that means that we go into either like fight, flight, freeze, or fawn, which is less talked about, but it's like people pleasing and making yourself smaller, and doing whatever you think you need to do in order to get through a situation, even if it's not what your like gut or your like conscious mind is telling you that you need to do or want to do, to be fully aligned with your values or what you think that you would need in that moment. That could look like if somebody's trying to force you to take a UA and you're like, I don't want to do that. I don't like understand why this is necessary, but I also don't want to get in trouble or have someone retaliate against me or cause further harm to me or my baby, so you do it anyway. That could cause trauma. So when we become outside of that immediate situation, when we're looking back and reflecting on it, and we keep reliving those moments, when we keep having flashbacks to a traumatic aspect of our birth, or maybe it's a family separation, maybe it's a feeling of being out of control or scared about what's about to happen, or it's an extreme physical, emotional, or mental pain. We keep reliving that over and over again cyclically. That is post-traumatic stress disorder. So again, there are many treatments that are available: talk therapy, medication support, support groups. Sometimes we can access those things through an intensive outpatient program, through inpatient, through individualized counseling. Sometimes we get support through calling a warm line, like the Perinatal Support Washington has a warm line that you can call and access support, and they will not call CPS. Postpartum psychosis is probably the one that folks have the hardest time with, and that is because of how heavily psychosis is frowned upon or stigmatized in our society. So if you are having, if you're questioning your reality, if you are wondering whether or not you're actually hearing somebody's voice that's in the room, or a person that you're supporting is having conversations or telling you about things that they are seeing that are not apparent to you, it could be a sign of postpartum psychosis. either way, if somebody is having visuals, whether that's flashes of light, feels like the room is sparkling, if they feel like they're seeing people, objects, things that are moving that aren't actually there, it is a good sign that we should try to seek support in some way, especially if those symptoms can be linked to thoughts or real threats of harm to themselves or others. So what I mean by that is that seeing altered changes in vision, especially if they are accompanied by like racing heart rate, dizziness, nausea, that can be a sign of, especially in postpartum, eclampsia. So we've talked about in the childbirth complications video, preeclampsia. Eclampsia is a similar condition, but it happens in postpartum. If somebody is experiencing changes of consciousness, that's also been accompanied by heavy bleeding, that could be a sign of hemorrhage or an internal bleed. A person who is experiencing conversations, thoughts, visuals, auditory hallucinations, sounds, or voices that other people aren't able to hear, that could be a sign of postpartum psychosis, and there is treatment for that. It is not a sign that you are unfit to parent. It is not a sign that you are don't love your baby, or that this is a state that will last forever. It just is a sign that we need to seek extra support. And it's especially important if you are a person who uses drugs, that you have extra support around you, because we know that the medical industrial complex can oftentimes, and especially the child, the family policing state can see this as a way to blame substances or exacerbate this as something that is only happening to you because you use drugs, when in reality this happens to people who have no history of substance use and is quite often not linked to substance use at all, but changes in hormones, changes in brain chemistry, the shock and trauma of labor and delivery, or the things that come after that, can lead to psychosis, and we want to make sure that you are getting the support that you need. So I hope that this was helpful, and I hope that this helped reduce some of the stigma around it. Never let anyone minimize your mental health due to your relationship to substances. Your mental health is real. Your mental health is important. We love you. We just want you to have support, and we want you to have the information that you need to advocate for yourself. So take care. We'll see you next video, and hopefully I get to talk to you in person soon too.